Interesting facts about pregnancy. It's no secret that pregnancy changes the human body. When a woman carries a child, her body has to go through many adjustments to make sure she and the baby get through the next 9 months, or thereabouts, safely. Before pregnancy, a woman's uterus is typically the size of an orange. By the 3rd trimester, it can be about the size of a watermelon. In fact, it can expand up to 500 times the size during pregnancy. The longest time on record that someone has been pregnant for is 375 days. Normally, pregnancy lasts around 280 days, so Penny Diana Hunter's baby was nearly 100 days overdue in 1945. Longer pregnancies are more common than you might think. Many women report being pregnant for 10 or 11 months, rather than the usual 9. The earliest premature baby to survive was in the womb for just 21 weeks and 4 days. The child, who started preschool last year, apparently has no health or developmental problems as a result of being born early. When pregnant, blood volume increases as much as 50% to help supply enough oxygenated blood to the fetus. Your heart grows bigger while you're pregnant. To help pump all that extra blood around the body, the heart has to increase in size. Many women also report that their feet got bigger while they were pregnant, as much as a whole size bigger. Ankles and feet can also swell up. With all the hormones coursing around a pregnant body, it's not surprising that there would be some changes. Another is that the voice can change. The rise in estrogen and progesterone can cause swelling of the vocal folds, meaning some higher notes are lost and lower ones might appear. Babies can hear their mother's voice from inside the womb. At about 18 weeks, a fetus is able to hear sounds. By 25 to 26 weeks, it is more responsive to noises and responds in the womb. Some pregnant women develop diabetes. Gestational diabetes is when a pregnant person's blood sugar is too high, and the pancreas can't keep up with supplying enough insulin. It usually disappears after giving birth. During pregnancy, the body produces a hormone called relaxin that softens ligaments, the tissues that connect your joints. This is to help make the pelvis more flexible during childbirth. Pregnant women usually experience a heightened sense of smell in the first trimester, which can be a sign that you're pregnant in the first place. It may be an evolutionary way to help pregnant women avoid unsafe foods. As a pregnant body changes, it can develop stretch marks, which are usually paler than normal skin. Women can also get melasma, which causes dark splotchy spots to appear on the face. The line down the stomach, called the linea nigra, also gets darker. The vagina can change color too. Some women report it turning purple or bluish, which is known as Chadwick's sign. About 10% of women also get blue varicose veins appearing down there, but they should disappear a few weeks after the delivery. Certain genes mean you can't get pregnant. After a year of trying to conceive, a couple is technically infertile, although that doesn't mean they won't ever have a baby. Sometimes, though, genetics mean a couple will never make a child of their own. A chromosomal disorder called Turner syndrome affects some women. This means they have just one X chromosome rather than 2, so she cannot reproduce. A common cause of male fertility is a mutation of the CFTR gene, which causes congenital bilateral absence of the vas deferens, CFTR. This means sperm cannot leave the testes on their own, but luckily, treatments can help men to father children. Your blood group could also have an impact. In 2010 a study found that women with type O blood may find it harder to conceive than people with different blood groups. Those with type A blood appeared to be more fertile. Blood can also be dangerous to a baby during testing. Pregnant women are offered blood tests. One of them determines whether they are rhesus positive or rhesus negative. Those who are positive have a certain antigen on the surface of their blood cells, which can mean problems during pregnancy. If a woman has a baby with a man who is rhesus positive, the child may have rhesus positive blood too, even if she is rhesus negative. In this instance, the woman can develop antibodies against the rhesus antigens. This usually isn't a problem in the first pregnancy, but may cause issues for subsequent ones. Pregnancy brain might be a real thing. Around 80% of women have memory impairment, according to research. But it's unclear what could be causing it. It might be the late nights, exhaustion, and the stress of welcoming a new life into the world. Babies can taste certain foods in the womb. Strong flavors such as garlic can pass through amniotic fluid, so the baby can taste them. In fact, when pregnant mothers drank a lot of carrot juice for a study, their babies were more likely to develop a taste for it. Pregnant women can start to lactate when they hear a baby crying. It doesn't have to be their own baby. It's all automatic. At age 30, a couple has a 20% chance of conceiving, but this decreases to 5% by age 40. Babies can cry in the womb. Researchers discovered this by accident when studying pregnant women who smoked or used cocaine. When a sound was played on the pregnant bellies, babies could be seen on an ultrasound startling when hearing it and opening their mouths. There could be a reason for strange cravings. Hormonal changes may disrupt pregnant women's taste and smell receptors, leading to them crave strange foods. Cravings could also be a sign that mother and baby are lacking in certain nutrients. For instance, craving red meat could indicate a deficiency of iron. Pregnant women often get thicker, shinier hair, but they also get more body hair. During pregnancy, hair can feel fuller and healthier, because it can grow faster. But women may also grow hair on other parts of their body, such as their abdomen, face, and back. During birth, the pelvic bone separates. The pelvis is connected by a narrow section of cartilage and ligament, which can sometimes separate during childbirth. For some, it may never fully fuse back together again. Being pregnant can cause carpal tunnel syndrome. Pregnant women can experience swelling in their hands due to a buildup of fluid in tissues. Sometimes, this fluid can collect in the carpal tunnel, causing pressure on nerves, leading to tingling and numbness in hands and fingers. According to the NHS, as much as 60% of pregnant women may experience these symptoms. Thank you for watching. Please like and subscribe.